Hi everyone, thank you so much for joining me for this Inca Evo demonstration. Today I thought I would just take you through our newest Inca Evo product, which is an evolution of our previous product Inca Classic. If you'd ever used the older Inca Classic version, you would know that it was quite a large program and it required people to change their workflows and go out of best practice to another screen. What we did with Inca Evo was we worked very closely with the clinicians and also best practice to try and integrate as much as we can so that it doesn't affect your workflow and you're able to continue on with what you need to do and work in best practice and Inca Evo at the same time. So I thought today I would take you through the platform. So let me show you here. On the right hand side, we have the Inca Evo bird. Now, you can move that up and down depending on if it's in your way or what you're doing at that time. This bird actually integrates with your best practice software and it reads the chronic conditions that the patient has on file. It also checks their billing item numbers as well. So it will check if a 721, for example, has been billed in the last 12 months, and it may alert you if this patient's eligible for a GPMP or TCA or a review. So when you're ready to, and if you need to, all you simply need to do is slide out the blue bird here. And as you can see, this patient is eligible for a 721. So I can click on Start, and that means I can actually start the care plan workflow whilst also working in my best practice system as well. The very first thing up here is that I'll get the patient's consent to have their care plan completed in Inca Evo. Over to the right here, you'll see a little button that says Notify Patient. Inca Evo actually has inbuilt electronic notifications out to patients as well as providers. So it means that if the patient has an email address on file, it will actually send an email to the patient with all of their electronic documents. If you don't want to notify the patient, or if email is not necessary or required, you can simply turn that off, which means no patient needs to be notified by email. Coming down here, you'll see that my conditions in best practice that have been listed over here have actually been brought into Inca Evo. So with that tight integration into best practice, it means that all of those conditions will pre-fill for you. However, you can see over here that one of them is actually missing. That's because this condition here is listed as confidential in best practice, and Inca Evo has been smart enough not to actually include that on the care plan. If you wanted to, what you could do is you could actually add a condition as well. So if there was something relevant just specifically for this care plan, you could also pop it in onto Inca Evo. That would include that condition onto Inca Evo, but it wouldn't change anything on the actual clinical record. Now coming down here, based on those conditions up above, it pre-fills a number of patient goals and activities. Now we work with our in-house clinical advisors and they assist us to develop these care plan goals and activities for patients. However, as you can see, all of them are actually editable. So even though it pre-fills them for you, it actually just pre-fills them for you as a bit of a guide. So you can delete the ones that aren't necessary. You could edit as well. So you could pop in some more specific information for that patient, and you can also add in your own goal as well. So you can very easily customize the goals and the activities for the patient based on their conditions and based on their needs as well. So once you're happy with those goals and those activities, you then come down to your provider section. So your provider section is where you actually add in your care team members. Now, based on these conditions, again, it has pre-populated a number of different sort of specialists and allied health providers that it thinks you might require for this care team. However, what I'm going to do is I'm actually going to click on Add Provider and I'm going to pop in the providers that this patient would like to see. Now, probably one of the biggest differences if you had ever used our Inca Classic product in terms of this product is that this product actually allows you to use the clinicians that are saved in your own best practice address book. So rather than updating the Inca address book plus also your best practice address book, you now simply just need to search your providers, and whoever is listed in your best practice address book will come across and you can assign them into this care plan or care team. So what I'll do is I'll pop in a podiatrist, for example. I might also pop in I'll just select them, and I'll also pop in an optometrist, and I'll pop in a physio as well. So they're my providers. The other providers that the system generated there, I don't need those. The patient doesn't need to see them, so I'm just going to remove them. Once I'm happy with these providers, I'll go back to the actual care plan window, and you'll see here I can actually now assign my referral visits as well. So it's popped in the provider there. It does have a little information icon here, which means that when it did connect into the best practice address book, it wasn't able to find those details in order to be able to send to these providers. So all you might need to do is just go into here if there's no fax or email address and pop them in there, and we will then be able to send out the referrals to these providers. So I'll just pop some email addresses in here. And once they've been completed, you can now see that I have the option to share this documentation with the providers. So what I'll do is I will assign 2 visits to the podiatrist and 1 visit to the physio. The optometrist is in the care team. However, I may not want to show or share the documentation with them. It may not be relevant, but they are a part of the care team. So I can simply untick the share button. If the tick here is shared, it simply means that based on that email address or phone number or fax number that I've just popped in, it will electronically share that information with them. It will share the TCA plus also any referral forms that I have also completed as well. And these referral forms will be electronically signed and documented. I'll show you what they look like at the end. Now, I'm happy with my providers. I'm also going to pop in some extra notes here as well. So often what clinicians will do is they'll pop in some more information in there for the physio, for example, if necessary and if required. There's a review date in here by default, so that's automatically set, but I can simply go through and change it depending on what's required for the patient. Now, before I click on continue and finalize this care plan, I actually can do a bit of a preview. So I can click on the preview button here, and it will show me all of the information that it picks up from the actual clinical record and that it's going to pop into the care plan. Because this window is quite small, we don't show you everything that's going to be included on the care plan. So this is your opportunity here to see just a bit of a preview on what that will include. So as you can see, it's going to bring across these 2 conditions here. If, for example, this one wasn't marked as confidential in best practice, it would bring it across into here, but this is where I would have the opportunity to actually exclude that information from the care plan. The same with social history, so I can do a bit of a preview. Medications as well, so if there's a medication that's not necessary that needs to be on the care plan, you can remove it from here. And also any clinical outcomes. You can work with your clinical outcomes and be completing those at the same time. So you could be doing your observations with the patient, popping them into best practice, and then Inca will automatically pick that information up. You do just need to make sure that your observations and any information that you want to include in the care plan is popped in there prior to finalizing the care plan. So I'm happy with my care plan here. You're able to then finalize the document. Now, Inca Evo is designed to work for both your nurses and your GPs. So we have both workflows for them. The nurse can simply complete all of this information. They can send it then to the GP to approve, and the GP can finalize and approve. Or alternatively, some clinics will also have where the nurse will complete it, finalize and approve it on behalf of the GP if the GP has given verbal approval and seen the patient. So just depending on your workflow allows you to then use Inca in the way intended for your actual processes. Now in this case here, I'm logged in as the GP, so I'm going to complete my own care plan. So I'll finalize this document, and as you can see, I can finalize the care plan. When I hit on finalize, you'll see a couple of things will actually happen. So as I mentioned at the start, we take care of all of the electronic sending and faxing. So if the clinician or the provider has an email address or fax on file, it will automatically send off to them once I hit finalize. If the patient has an email address on file, it'll also do the automatic sending as well. And at the same time, it will also automatically push all of the documentation back into your best practice to keep your clinical record whole for auditing. So once I've completed that, you'll then be able to see all of the completed items that have been completed for this patient. I just did a 721 and a 723. If this patient was also due for a review, I could also complete my reviews from here as well. Now we'll just come over to the actual documentation. It will be located in Correspondence Out. You may actually need to do just a little bit of a refresh for those documents to appear in your folder. However, once you're there, you can simply then click on that and you'll be able to see the care plan. So as you can see, all electronically completed and signed. And if the patient doesn't have an email address on file, this is where you would be able to print them off and provide them a copy as well. And just quickly to finish, I'll also show you the Allied Health referral form that's generated. As you can see, all electronically completed and electronically signed and dated. If you have any questions, please feel free to reach out, but that's just a really basic and very, very quick overview into our new Inca Evo product. I'd be happy to answer any other questions that you might have, so feel free to give us a call, but I hope that helps. Thanks so much for your time.